Hello, everyone. It's Nursing 204 with Karen and Deb back again. It's so good to see you all. Yesterday in the Zoom meeting, it was great. And yay to all of you as you work so hard. We're truly impressed. So keep up the good work, most definitely. So right now, we get to go through some fun stuff. We get to talk about different dressings. We get to talk about sutures. We get to talk about staples, and then also using Steristrips. So we're going to go through all that and just introduce you to those pieces of equipment and talk about them and just help to teach you about different things that you will be seeing when you get out into the clinical setting, most definitely. So we're going to talk about dressings first. So you are going to see a lot of variances in dressing changes. I think wound care has become a new situation that we have been doing a lot more studies on. We've tried to advance our technology on this to really help with knowing what is best to use for the different types of wounds. You will be seeing some pretty significant wounds as you get out into the field, most definitely. So this will be an overview of that, and hopefully when you get into the facility, you'll get to follow a wound care nurse and just really get the experience of seeing different wounds and what is done for treatments and cares for those wounds. So, and what's really cool nowadays is people take pictures, which is really cool to see in the chart. You can see what the wound looked like initially, and then as the wound starts to heal and progress, you can see those pictures in progression to just be aware of the changes that have occurred as the wound has healed. So, first of all, I'm going to talk about, these are two different alginate products. One has some silver in it. That's an antimicrobial. The other one is an alginate that is used. These are put into the wound beds. What these do is they absorb the fluid out of the wound so that the fluid isn't sitting in the bed of the wound, creating media where bacteria can grow and the wound can progress. So alginate, these are two different kinds. This one is has some silver particles in it. It's an antimicrobial, and this one is just, well, blue dot. And this one is just an alginate that is an absorbing material. Then another product that you might see out there is it's literally called a gelatin sponge. It looks like this. It just looks like a little piece of foam, most definitely. But it's impregnated with gelatin, and this too will absorb, and this sponge will grow in size as it absorbs fluid. And it, of course, it's a sponge, so it acts like a sponge, but it really helps to wick that extra fluid away from the wound bed. Sometimes just regular gauze dressing is placed into wounds. This is just non-woven sponge. Usually you don't use the sponges that have the woven threads, just because you don't want, sometimes those threads can loosen from the dressing and you don't want that to be introduced into the wound bed. You don't want to start getting foreign material into wounds. So usually it's more an interwoven sponge that gets used, and the wound can be packed with this. Also too, if there's any sort of drains, we have the split gauze sponges, which is when there is a slit down the middle of the gauze, and I apologize, I don't have one of those with me today. But those are used around tracheostomies. They're used around JP drains or any sort of hemovac drains, any sort of drains that use a tube system. So that would be another option. Also, too, the roll of gauze, like what we used when we did the wound care, that can be, I think we showed you how it's just kind of woven back and forth in the wound itself. What that does is it helps to wick away the moisture. It also helps to, we put some sterile water on that gauze when we did wound care, and what that does is it helps to keep the wound bed moist, but not overly moist. It still has the capability of wicking and pulling away drainage. So that is another option as well. Then you'll see they'll put medications oftentimes. I've seen antibiotics literally sprinkled into wound beds. You will probably see many different things as you get out there. Oftentimes you'll find that in facilities they may stay pretty consistently with a certain regimen, but if you get the privilege to be in the hospital and be with a wound care nurse, you're really going to get some cool exposure with that. So just an awareness. Then when you start dressing your wounds, this is a petroleum dressing. It has a little bit of Xeroform in it, which is a iodine based dressing, and so it helps with continuing to provide an antimicrobial surface that goes into the wound. So that might be one that you would see. Also an oil emulsion dressing. This is also one too that it has the oil base in it, and that just helps to maintain moisture in the wound, helping to protect it, also helping those tissues to granulate and heal. You may see that the doctor wants a non-adhering dressing. In the facilities, unfortunately, our elderly people fall. And what you will oftentimes see is skin tears, and you'll see that their skin is incredibly fragile. So oftentimes the doctor will order a non-adherent dressing, and with this dressing, it has kind of a plastic type, I don't know if I'm going to be able to show it very well. It has kind of a plastic type covering on it, and it can go up against a wound bed, but it won't stick to the wound bed. It might stick a little bit, and you can use a little bit of sterile water on it or a little bit of saline, and the dressing will just fall off. So Telfa is a name that you'll hear oftentimes. It's just a non-adherent dressing. If you have a wound that really has a lot of drainage and all, no doubt you'll use an ABD pad. These are nice, cottony, fluffy dressings. We use this with Jane's Tiny when we did the dressing change. And this is just a nice thick, I don't know if you can see, it's a pretty thick dressing. I believe that we put some of these in your bags if you had the privilege of getting to come and pick up a bag of supplies. So you probably have had a chance to look at these already. But they cover a large area. There are two different sizes. This one's 7 by 8. I think the other one is a 3 by 5, but they are larger dressings that cover a large area. You will also see some gel foam dressings, and this is one in particular. What it is, this particular one has tape that goes all the way around this foam pad. But what this pad does is it helps to keep moisture in the wound bed. You do want some moisture. If you dry out your wound bed, that's going to start causing some tissue death. And so you do want some moisture in your wounds to help to continue the healing process and all. So you might see a foam dressing like this, and they're just very nice. They add extra cushion. Meanwhile, they have tape all the way around the foam so that you get a pretty good seal. This is a plastic window that you can put over a dressing. I usually don't see these very much anymore, but you might have this, or you might have this sort of dressing, like what is used over IV sites, if you're familiar with that. But it's a Tegaderm dressing, and this just creates a window so that you can look inside and see how things are underneath. So these are two different products that you may see. So that's just a brief introduction and overlook of different types of dressings. And stay tuned. We'll be back with Steristrips and staples. Bye for now. Hello. We're back again. I found Karen. So we're here. So now we're going to talk about sutures, staples, and Steristrips. And in the video, there is a really great video that
we'll be sending.
Exactly, that shows you how to do sutures. And in your packets that you're going to be getting next week, we have some felt. You can use the felt and pull the edges of the felt together and suture it. And then what we're going to talk about now is removing. You probably won't get to do too many stitches in your career, but it's fun to do for now. So what we're going to do now is talk about removing sutures and then also removing staples. And these sorts of skills you do need to practice because you will be doing this. So we're going to start out with the suture removal first. So there are wonderful little kits. It has everything enclosed in there. They're really helpful. And if I can open it. So what you'll find in here, hopefully I can show you without dumping them out. So there is tweezers and scissors, and then there's some gauze in there as well, and alcohol. Is there an alcohol?
Usually. I'm a liar. This one. This is a cheap kit.
It's a cheap kit. Absolutely. That's why we have them.
That's right.
So these are the scissors. Whoa, where'd I go? There it is.
Oh, yeah.
So there's a little hook. You can see that little hook right there on the blades. That is hugely important because when you are starting to take a suture out, what you will do is,
I'm trying to make it seeable. Okay, you can see how there's a knot right there. There's a knot with the two pigtails of the suture material. And what you want to do is you want to slide, you use the little hook part of the scissors. Let me see if I can get up here enough to do it. You want to hook under the suture in front of the knot. You don't want to cut both pieces.
Cut, yes, exactly.
One part only.
Oh, Karen did a great job of suturing. You got this nice and snug. So it goes there we go. So it slips underneath. That's why there is that little half moon right there, because it's the suture is cradled right in that little notch right there. And then you snip it, and then with your forceps, you want to grab a hold of the knot here, and you should be able to then just pull it out. So do not cut your knot. You want that knot to stay there because you want to have a tail of the suture so that you can pull it out and pull it through. If you do cut the knot,
you will probably have a suture that stays embedded in the open wound, in the wound there. So you want to make certain, Karen's drawing now, you want to make certain that you catch it on this side or this side. Either side is fine. You just want to make certain that you still have your knot intact so that you can pull it out. You can grab hold of the knot really and pull it out whichever way. So hopefully that makes sense. Sometimes, sorry,
when you pull on one side here, you don't necessarily have to pull it out, but if you pull on one side, it will usually pull up one side or the other of the stitch so that you can grab hold of that one side.
yes.
But if you grab the knot itself, for some reason you'll pull up both sides. So just be careful of that.
Be careful of that, exactly. And sometimes what you're going to find is there is drainage, like dried serous drainage over the sutures. So sometimes you need to use your little gauze that's in your packet and just wipe over the suture area before you start removing.
With alcohol helps too.
Alcohol does help too. However, sometimes if there's still some open areas in the incision, it can create some discomfort for the patient, but absolutely. So then oftentimes with removing the sutures, what you then want to follow up with, you want to do this with both staples and sutures. I wasn't certain whether to talk about this now or go ahead and talk about the staples.
Yeah. Let's do the staples so that we have something to show.
Absolutely. So with staples, pretty cool. You'll see staples in any sort of surgical procedures that are done, like hip replacements, knee replacements. It's literally, when you look at the staple, it looks like a real staple, like what you see. So when you use the staple, when the doctor uses the staple gun and puts in the staple, it looks like regularly what a staple looks like in a paper stapler, honestly. These prongs right here are open, they hang down. When you use the staple gun, what that does is it kind of flams out these two sides, and it grasps the skin, and then as you inject the staple all the way, it pulls those ends together, and it helps to pull the wound close so that it will be held secure. But it also helps to draw the edges together. And you'll find oftentimes with skin, whether it be a wound caused by from surgery or from any sort of injury, sometimes you need some help with drawing the two edges of the wound together and approximating the skin.
Huh. That worked out as well as I hope.
There.
Wrong way.
Yes. So when you are asked to remove some staples, once again, we have little pre-made packages here, which is great. And when you open it up, once again, we have a little gauze right here, and then we have this great little tool right here. And let's see here. It's kind of hard to see. There are three little prongs there. There's two on one side and then one on the other. And what this does, you go in under the staple. So you go in under the staple. You have the two prongs on the bottom and the one prong on top. And then you pinch it. And what that does is it creates, Karen drew a picture of it here. It creates this sort of M shape. I don't know if you can see that very well, but it pushes down the center of the staple, and that then pulls these edges apart so that it pulls it up out of the skin, and it'll kind of stick in the skin a little bit. Just do a little gentle rocking motion, and that will help to release it. But it just helps to open that up so that you can pull the staple out. Now then, if you are removing staples or you are removing sutures, what you want to do, you can take about 2 or 3 of the staples out, but then what you want to do is you want to start putting the Steristrips on. And the reason I say that is because oftentimes, depending on where the wound is, say it's right on a knee or something like that, when you start pulling out the sutures or taking the staples out, what will happen sometimes is the wound will open up again. So you want to only take away part of the sutures and the staples a little at a time so that the wound won't open back up again.
So these, there's been one removed here, one removed here, and so before we'll put a Steristrip on before we remove the others.
Yes, absolutely. Absolutely. So what you want to do is you want to put some skin protectant on the skin before you apply the Steristrips. So I have some non-sting skin prep here. So you want to wipe around the edges of the skin right here. And then I'll show you a little trick with Steristrips. It's kind of cool. There are several different sizes. What I have right here.
Down.
Oh my goodness, I'm really off today. So it is. These are 1/4-inch Steristrips. I also have, these are 1/2-inch Steristrips. Like, I tell you, opposite. My brain doesn't want to go that way. So with,
Yeah, just show them how you're going to do that right there.
okay. So with the Steristrips, you can cut these at different lengths, different sizes. So we can cut this in half. And then there's a very cool little trick that you can use. Thank you. So on the either end of the Steristrip, there is a little, there's a little piece that's already pre-cut. You can take that off and expose your Steristrips. And then what you want to do is, after you've put your skin protectant on, so that you keep your edges approximated, what you want to do is, oh, I'm sorry. I just got so excited to show.
I know, I can't.
There
we go.
Maybe
There
I
you go.
can put it on your.
There you go.
Okay. So what you want to do is you want to put it, go ahead and lay all 3 of those strips on there because you've got them all nicely spaced. It's all smooth. These can get botched up kind of like tape. It can get stuck on each other and everything. Then what you do is grab that piece of paper, flip it, and pull it, and you have, ta-da, you've applied your Steristrips in a smooth way, kept it in the uniformal spacing, and this will help so that it will keep your wound held together, and you won't have it pull apart, and then you have a big open wound to take care of. So it's really important to protect your incision lines. They're fragile. Those are freshly granulated tissues there, helping to mend the wound. So make very certain that you're taking special care with that.
Education of the client for removal of Steristrips.
Yes.
They don't remove them.
They don't.
They wait. When you have Steristrips, they usually put Mastisol over them or maybe not, but they can shower with them usually after a couple of days. And then they start to curl at the ends. And then what you tell them is to cut those curled ends off, but do not rip the Steristrip off.
No, it will naturally wear off. Absolutely. Absolutely. So I think that's it for now.
Okay.
Okay. And hopefully we didn't mess up this video.
And this other form, this is to telling you if you do this upside down like this, what you can do is make that staple go deeper into the skin and very, very difficult to get out.
Yes.
So always one on top, one on top, and it has a little great little handful sometimes. Just make sure one on top, okay?
Absolutely.
All right.
Okay. Bye for now.
Bye for now. Okay, let's see if we can find the stop button. Yeah, oh yeah, go wash your hands.